Are you or a loved one at risk of needing nursing home care in the future? Well, there is a little known risk factor that can determine your fate, and it's much more common than you think. This video uncovers the truth about adult spinal deformity, what it is, and we'll also talk about a safe, effective method for addressing adult spinal deformity. Imagine being able to predict if you or a loved one will need nursing home care in the future. What if I told you that there's a condition called adult spinal deformity, and if you have it, that can accurately predict just that? It's not just a predictor of pain, disability, even shortened lifespan, but it is an accurate predictor of if someone will need future nursing home care services. Adult spinal deformity is much more than a spinal issue. It is a life-affecting condition. This video is here to educate you about what adult spinal deformity is, how to detect it, and why detecting it early is so significant in helping to reduce your risk of future nursing home dependence. Unfortunately, as too many of you may know, nursing homes everywhere are full. Often, if you need to get some care for a family member or a loved one, you have to get on waiting lists, and that can take months or even years. And then once you or a loved one or a family member or friend is in a facility, it can drain one's life savings fast. But I'm here to tell you there's hope. If you can identify if one has adult spinal deformity and take action to correct it, that can significantly lessen the likelihood of needing nursing home care in the future. So you might be thinking, if this is such an accurate predictor, why haven't I heard about it before? Well, the truth of the matter is many healthcare professionals, including chiropractors, are not up to date with the latest research information out there on spinal posture, alignment, and the implications on health. And we're going to dive into more of those facts that will give you information that you can even share with your healthcare team members. This video is your opportunity to get ahead of the curve, learn what the experts know about adult spinal deformity, how to evaluate if you have it, what to do about it in a safe, non-surgical approach. Hi, I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. I created this channel to give you information on tips, strategies, and tools on how to improve your posture and alignment so that way you can feel better, move better, perform better, and have overall better health. So what exactly is adult spinal deformity? Well, adult spinal deformity is a collapse and loss of the normal spinal alignment. This can happen in a few different planes. There are a number of different classification or types of adult spinal deformity. What we're going to talk about today is the type that's related to having increased likelihood for nursing home care in the future. And that is adult spinal deformity in the side or sagittal plane. The measurement we use is your 7th cervical vertebra. There are 7 vertebrae in the neck region. And we look at the alignment of C7 in relationship to the sacrum, the triangular bone that the spine sits on top of. Now, as most of us know, the spine is designed to be tall. Healthy spines are tall, healthy spines are not crooked. So when we have adult spinal deformity, that is a shift in the spinal column where C7 translates forward. That is often associated with the thoracic hyperkyphosis, forward head posture, and there's a cut point that's extremely important, and that is 50 millimeters. 50 millimeters is about 2 inches. Once someone is beyond 50 millimeters forward, they have adult spinal deformity in the side or sagittal plane. And a breakthrough study that was published in the Journal of Gerontology in 2023 showed that when you have a collapse of the spine greater than 50 millimeters, you have an increased likelihood of needing nursing home care in the future. This was not a small study. There were over 800 patients in this study, and they followed them for 5 years on average. And what they found was they looked at how much total displacement one could have, and they divided that distance up into quartiles. Every quartile more forward that someone has, or the greater the severity of the adult spinal deformity, they're each quartile equal to 79 times greater likelihood that they would be in assisted living within that 5-year follow-up period. So now you know why it's so important that if we are starting to collapse forward, if we have adult spinal deformity, we have to take steps to correct that as soon as possible. A 5-year follow-up, these people were in their 60s. They had some people in the study that were older as well, but a look around and there are a lot of folks in their 60s, even younger now, because of time spent on devices and iPads and smartphones, where we're even seeing children come into the office with adult spinal deformity. So this is a big issue that you need to be aware of, and then you need to take action to address it. So now the big question is, what do we do about it? Well, here's the information, folks. When we start to lose posture, when the posture alignment starts to collapse over time, what connects bones together? Ligaments. The ligaments start to change. They start to shorten in some specific regions that allow this collapse to continue to happen. And unfortunately, traditional adjustments, physical therapy, while there is value that can help to create some movement in these regions of the spine that get stiff, strengthening work with physical therapy is important. There's value to try to help us not collapse more, but those things do not address the ligamentous change. So as we talked about before, there's a theme here that you'll start to see. So the number one way that has been shown to reduce adult spinal deformity, to correct adult spinal deformity, is through what's known as corrective chiropractic care. So what that does is it utilizes traditional adjustments to improve mobility, decrease pain, but then to address the ligaments that have changed over time, we have to employ the EAT protocol. If you remember from other videos, we have to do mirror image exercises. We have to give exercises that can train the body. What is it like to start to move in the direction where the spine is designed to be? We actually do specific adjustments in the mirror image. Same thing, we're telling the brain, hey, what is it like to move the body closer to where it's supposed to be? And then really the key factor here is the T in the EAT protocol, and that is mirror image traction. Oftentimes in these cases, we have to use specific traction equipment. One of the most common ones we use here is the Denny roll traction table system, where we can actually apply straps and forces and weights where we gently over time apply forces that can stretch those ligaments and allow the bones to get back to a more proper alignment. So it's really a matter of applying the right dose of force over enough time to actually change the ligaments. What does the research tell us? To change ligaments, we have to apply enough force for between 12 to 20 minutes per session to get some change in the ligaments, some viscoelastic change that will remain permanent. So that's why the traditional chiropractic care, acupuncture, or physical therapy, we don't do exercises where we hold exercises for 12 to 20 minutes. No, as I said earlier, those things have value, but you really need to add the EAT rehab protocol, which research has shown through randomized controlled trials to have the greatest likelihood of resolving adult spinal deformity. So as promised, I want to tell you, how do you find a provider in your area that's educated and is an expert on adult spinal deformity, and not only an expert on knowing what adult spinal deformity is, but an expert in correcting adult spinal deformity? Well, this is pretty great. You can go to any computer, go to your browser. I want you to go to www.idealspine.com. There you can enter your zip code, enter your city, and find qualified providers that know what adult spinal deformity is and how to address it safely, effectively, and without surgery or drugs. Lastly, I want to hear from you. Let me know your experience. Do you notice that you, loved ones, or other friends are starting to develop that adult spinal deformity, that translation in the side plane? Have you gone through care? Have you worked with a corrective chiropractor and have been able to reduce your adult spinal deformity? Let me know if there are other topics that you would like us to address. Talk about those in the comments below, and I will try to address those in future videos. For now, thank you very much for watching. Hopefully you know what adult spinal deformity is, why it's so important to make sure that you, family, friends, loved ones do not have adult spinal deformity, and then most importantly, what to do about it to reduce your likelihood of needing nursing home care in the future. Thank you.